how you rescue someone. Did you see some of the rescuers just suddenly dropping the patient? Those are things that we want to prevent. That's why we are undergoing training. Okay? Remember guys, you may have good intentions, but because of lack of training, especially when it comes to medical services, you might end up experiencing one of the things that we fear as a rescuer. Number 3, right? Killing or hurting someone. And technically, these are the things that we want to eliminate out of training, right? What are the things that we want to eliminate? First, number 1, besides from the fear, okay? We want us to be secure, that we won't be ending up being liable for a certain act, okay? So number 2, unknown. Number 3, killing or hurting somebody, getting killed or hurt or disease. That's why I'll be tackling that as we go along with the discussion that we'll be having for this afternoon. Okay? So for our learning objectives, guys, for this afternoon, we will be learning about command responsibility. Okay? This is very important, especially if it's a mass casualty scenario, or even in a simple scenario wherein you will experience somebody in front of you losing consciousness, not breathing, or breathing but has no consciousness. Okay? It's important that you learn command responsibility. EAP, Emergency Action Principles. What are these principles? How are they followed? Why do we follow these principles? Why do we need to learn them? Okay? Why are some rescuers not suddenly entering into the scenario and intervening? Bakit hindi sila nag-intervene kagad? Bakit may ginagawa muna sila? They are practicing 5S, or size up the situation. Number 1, safety. Size up the situation. Set for help. Set up the scenarios or the necessary treatment. And lastly will be the start triage system. If we still have time, we'll tackle the start triage system. That will be especially for mass casualty scenarios. Okay? And of course, we would like to differentiate prepared and unprepared rescue. So technically, when you're prepared, you will have certain equipment, like this one. Like the following equipment. Basic equipment for BSI. When you say BSI, that is pertaining to body substance isolation. This is especially necessary if we don't want you as a rescuer ending up getting a disease. Okay? Again, these are the things that we would like to eliminate through proper training. Okay, guys? So, first thing that I would like to share to you guys is on how to use what we call the BSI or the PPE, Personal Protective Equipment. When you say personal protective equipment, these are equipment that you use for what, guys? For protection. Against what? Diseases. Or you getting contaminated with a certain disease of a patient or a victim. And of course, patient handling is also part of what we call first aid. Who among you knows what first aid means? I'm sure some of you have attended training already. And what is first aid? In Tagalog, ano po ang pangunang luna?
Unang panluna.
Unang panluna. Meaning, it is something that you give to a person who has suddenly fallen ill that requires or needs immediate treatment, immediate attention. Okay? That means you're giving immediate care. Immediate care. That aims to do what? We have 3 objectives. Actually, some would use 3, some would use 4 objectives. Number 1 is prevent further injury. These are the basic objectives of a first aider. Okay, when you say first aider, that's the person who is implementing first aid, giving the first aid. So number one rule, prevent further injuries. One objective. Second objective will be prolong life. Okay? Number three objective, alleviate pain. And we can add another one, which is promote recovery. Okay? Sir, number one, lawsuit, fear. Why do we fear being sued? When you go abroad, guys, there is what we call the Good Samaritan law. That's what protects responders from getting sued or getting in jail if ever you have good intentions to help somebody in an emergency situation. Okay? And that person died or got hurt. Okay? Because normally in the US, if you ever go into the US, you need to be familiarized with the different types of Good Samaritan law depending on the state. So if ever you'll be entering into the medical treatment career, you have to make sure that you are aware of the state laws. Okay? Ignorancia legis is not excusable. It's really important that you're also familiar with the laws of the land if ever you'll be entering into such situations. And the good thing about the Good Samaritan law, it protects you as a responder from getting sued. Or kayo po ay makasuhan. Yun po yung pinoproteksyon sa inyo ng Good Samaritan law. However, here in the Philippines, walang ganun ka. We still don't have that. But we have what we call justifying circumstances under Article 11 of the Revised Penal Code. And we also tackle that justifying circumstances as we go along with our personal protection topic. I'm going to teach you personal protection perhaps by end-term period. But for now, lawsuits, we can eliminate that if through the help of the Good Samaritan law and of course you understanding your objectives as a first aider. These are basic objectives, guys. And roles of a first aider. Meaning, guys, as long as you know the boundaries, your limitations as a first aider, you're safe against lawsuits. Okay? Do not go beyond this. If you do not know, second part, guys, what to do. Perhaps you have forgotten what you need to do because you haven't had your training for a long period of time. Okay? Just remember 3 things to 4 things. And that is, what guys? The following. Prevent further injury, prolong the victim's life, alleviate pain, promote recovery. You always go back to this point. Okay? You're not sure, where do you go back? To all of these basic objectives. Hindi nyo alam yung gagawin nyo, balik kayo dun sa ano na yan. Ano ba? Madadagdagan ko ba yung sunod ng victim ko? Will I add up to the injury of the victim? Will I be prolonging his life? Will I be alleviating his pain? Or promote his recovery? Pagka wala natin yung boundary, huwag kayo lalapas doon sa boundaries din, just to make it simple. Is that clear? Okay, and this one, killing and hurting, remember, as a rescuer, we will experience people dying in front of us. And one of the most traumatic experience will be you losing somebody you love. It may be a stranger, someone close to you, a friend or a family member. But remember, killing and hurting a victim who is already injured, or let's say, especially for cardiac arrest, remember guys, when a person experiences cardiac arrest, he's already dead. Okay? Because you might be afraid of hurting the person, breaking his ribs, injuring him further. But it's a lot better to do what is lesser evil. Okay? Have this mentality, guys. Do that lesser evil. Okay, what does that mean? Sir, I have a dirty triangular bandage, also known as an all-purpose bandage. We are in a desert. It's already dirty. But accidentally, a friend of mine who is traveling with me gets injured, gets a puncture wound, and he's extremely bleeding. Okay? Is it okay to use a triangular bandage to stop the bleeding? It's dirty.
No. Yes, sir.
Yeah.
Yes.
Who says yes? Who says no? Who says I don't care? Seriously, guys. When you say if the triangular bandage is dirty, you can still treat the victim's injury for infection. Whenever the person gets infected, okay, because of the contamination of the blood because of the dirt. However, again, let's go back to this one. You're not doing anything. For example, that guy has a puncture wound, severely bleeding. That person will die out of what? Losing blood. That person will die out of losing blood. You do not do anything. So it's a lot better to make use of an equipment, a medium, to provide the victim with basic treatment so that you can prolong the life of the victim, prevent further injury, and alleviate the pain of the victim. Okay? Because if ever that person uses extreme bloody fluid or blood or extreme fluids, the person loses a lot of fluid, it will lead to hypovolemic shock. When you say hypovolemic shock, that means the person will probably die because of losing too much blood. Okay? So, just do the lesser evil, guys. Okay? There will be certain rules that I'm going to teach you that will not be applicable in certain scenarios. So it's a lot better that you know a lot of things rather than just focusing on one rule to another rule. Just always go back to this rule. If ever you're not sure, focus on the do the lesser evil rule. Okay? So, number 4, this is another part of the most dangerous, one of the fears of us rescuers, us getting hurt or getting killed. That's why we try to invest in training skills and knowledge, because through that, we get to know what we need to do in a certain scenario. Okay? And lastly will be the disease. So that's why it's really important that you always carry one of this, right? Face mask. It may protect you at a very simple level. However, still it is still protection. Okay? But much better if you're a person who is going to be responding to a situation. It's a lot better if you have some of the basic equipment. What are the basic safety equipment against diseases? We have what we call PPE. What does PPE mean, guys? Personal protective equipment. So, the personal protective equipment will include respirator protection or respiration protection, that will be for your breathing. We have our body protection, basic medical lab, disposable medical lab. We have our eye protection. We also have our hair protection. And there are also other PPEs that would include you covering your foot or legs. So there are proper procedures on how you make use of your PPE. What are those procedures? We call them donning and doffing. Okay, donning means, who among you knows what donning means? Donning. Donning. What does donning mean? Donning means you putting on something, your equipment, putting on your equipment. When you say doffing, you're removing your equipment.
Putting.
Doffing. Donning and doffing. So,
Putting, outing, ano daw?
Donning and doffing.
Yung doping. Removing.
So, how do we don our equipment? Properly don our equipment. So first, equipment we can don. Guys, we have what we call face mask. We have what we call the lab gown. Okay? Or lab scrub. Normally, this is to protect you against blood pathogens that might infect you in case that you will be responding in a certain situation. Okay, so what do we first do? If we are going to wear our lab gown, what do we first do? We insert our arms and we remove our accessories, of course. Okay? Remove your accessories. Properly put on your gown. Any side will do, right or left. That really depends on the situation. If ever, especially here in the Philippines, sometimes you will not see rescuers wearing this. But for their protection, it's really good that you have your own personal protective equipment. If you're really going to work as a rescue responder, right? Because normally, who are the ones who are wearing this? Doctors and medical practitioners. However, it's not a good practice here in the Philippines to wear this as a rescuer. But technically, as a rescuer, you're also exposed to diseases. You are not exempted from the fact that you might get a disease when you're doing a rescue operation. That's why it's also, if ever you become the EMP of your future companies, practice having your own proper equipment. Okay? So how do you tie this? You just tie it down and tie a bow tie on your side, and you also tie
Ayoko yan. Gusto ko na rin dinidikit lang. Para di mahirap.
This is for prepared scenarios. Remember guys, we have prepared, and unprepared. In unprepared scenarios, you just maximize what you have. But if it's a prepared scenario, normally you will have this equipment. Okay? So again, anything that you can protect yourselves against particles. As much as possible, because you are not sure. You are not 100% sure that the person that you are rescuing doesn't have HIV, doesn't have hepatitis C, doesn't have hepatitis B. Okay? Remember guys, when you do something such as responding to a situation, you are really exposing yourself to a lot of danger. That's why we are trying to name the problem so that we can prepare against them. Okay? So, worst case scenario guys, you don't have any equipment, just be sure to be very, very careful in intentionally doing things in a slow manner. Slow but yet sure that you will not get contaminated with any diseases. So, first, the lab gown, then you can wear your respirators. This is what, number one, we call this face mask or procedural mask. Okay, normally this is a protection against droplets. Like for example, if the victim that you're responding to is someone who has influenza, okay, you want to protect yourself against the influenza virus. Okay, there's information that I got that there's a proper way of wearing your face mask. One will be the colored part. You wear it this way if you are not sick. But if you're the one who is sick, you wear it this way. It's an information I read in an article. So it's better to know than not knowing, right? So technically, one of the first things that you have to do when you're going to wear your procedural mask is make sure that you fit it into your face. Okay, then you come. There's a dent here, a metal part na pwede mo siya i-dent. Make sure that it fits properly. Then come it on both of your ears. And make sure you spread it out and snug it tightly to your face. Okay? Try to snug it tightly to your face. So, if you have a respirator, like this one, respirators, this is what we call the N95. It is much better than the face mask or the procedural mask because it protects you from small particles. That is another respirator that you use especially for protection against chemical gases. You will gamit mo sa isang respirator. Now, how do you properly don this, guys? What you do, hold it in the bottom, then put one part at the back of your head. Okay? Make sure that you place it inside properly. And then, the other part, the rubber band, you place it at the back of your knee. Make sure that the hair is touching the rubber band is touching the skin and not placed on top of your hair, especially for women.
Airway.
Kasi po, pag nandun siya sa may hair, lumulubog siya. It loosens up. Loosen up. So, make sure it's also snug properly. Okay? There are some respirators, guys, that you can use or mask that already contains eye protection. There's already face mask or equipment that has eye protection. But there's no eye protection, you make use of any possible safety glasses. There are a lot of kinds of safety glasses. There are also what we call goggles. Pwede po tayo magsuot din ng goggles. And the last part that we will be wearing is the gloves. Okay? There are latex gloves that are available. Okay? Just be careful that you have to be sure that the latex gloves, you are not allergic to latex gloves. Meron kasi may mga tao na nagiging allergic sa latex gloves. So make sure, guys, you cover okay, insert it properly so that there will be no excess. And be careful, guys. Make sure that you do not break off the gloves. Because of what reason? The purpose of the gloves will be
Useless.
it will be useless if there will be a break in your gloves. That's why sometimes what we do, guys, for best practices, we don't just use one glove. We actually don't just use one glove. And we keep an extra glove. Okay? So some rescuers or responders will use at least 2 gloves. Okay? Yes, that's one of the reasons. Sometimes there might be a break in the gloves that could cause contamination. Okay? So that's how you properly don your personal protective equipment. Now, how do we take this off? Well, there's also a proper procedure of taking off your PPE. So what is the first equipment that you need to take off? Of course, the gloves, because this is the most probable equipment that has been contaminated. And how do we properly remove the gloves? Okay. What's the basic rule?
Kailangan, sir.
Skin to skin, glove to glove. Meaning, this is the first glove. You hold the glove to glove, then you try to remove it. Okay, as carefully as possible. Okay? Then try to hold it with your other hand. Okay? And then, in beneath the skin, you try to remove it with the other hand. Okay? Skin to skin, glove to glove. But in this scenario, guys, we have 2 gloves, so at least you are more protected. And this one should be placed in a hazardous material bag. Okay? If it's a prepared scenario, you have your hazardous material bag. So do we remove the second glove? Actually, you can just keep it there for the meantime so that you can, because again, one of the things that is contaminated is your lab gown. There might be blood spills on your lab gown. So what you do, you keep both of your hands protected with your gloves first, then try to remove it as carefully as possible. Your lab gown. As slowly as possible. That means you do it intentionally slow, so that you will be preventing aerosolization of particles coming from your personal protective equipment. That means you remove it, you remove the tie, then hold it as carefully as possible. You remove it slowly, then you roll it together as much as possible, guys, like this one. Roll it over like this way, so that you will not be contaminating your body with the lab gown. And then, because this is a disposable lab gown, what do?
Tapon.
Again, we throw this to our hazardous material bag. Okay?
Sir, pwede ka magpatulong kapag magtatanggal ka ng gown?
That depends. If it's the perfect ideal scenario will be you having a body. But in this country, seriously speaking, most of the time it's either there's one driver or there's no EMT inside the ambulance, right? So let's be realistic. It's you being prepared as a responder and you being somebody who's already aware of the things that you should be doing during certain situations. Okay? So do we remove the gloves already? We remove the gloves after we have removed the eye protection. Okay, how do we remove this? We do not try to hold the eye protection to the front area. Instead, you remove it on the side, and as carefully as possible, you remove your eye protection, and then try to throw it in the trash, hazardous material bag, or you can have it reprocessed, meaning try to decontaminate it, sterilize it. Okay, you can place it in a designated area in your ambulance, or for example in your base, or in your equipment, wherein you can try to place your eye protection for decontamination. Nice. Then you can now remove the last gloves. Okay. So it can be, again, how do we do it? Glove to gloves. Okay. Slowly as possible without you breaking the glove. Glove to glove. Then try to place it inside of your other hand. And then the other one, you insert skin to skin. Then try to remove it as carefully as possible. Okay, guys? Then place it in your hazardous material plastic bag. Now the last equipment that you remove is the face mask or the face protection. Because of what reason? Again, the other equipment can contaminate you with particles, small particles. That's why you protect your respiration through the use of the face mask. Okay? So, stop here, guys. Do you have any questions about donning and doffing? Okay, guys? Now that we're here and prepared, and we are going to be responding to a situation. You know that? And not much equipment, but you have basic equipment. It's like gloves. So, what are the things that we have to be aware of in our environment? We have to be familiarized with the EAP, or Emergency Action Principles. We conduct our first survey, primary survey, secondary survey, to make sure that we follow the 5 F's. Guys,
Ganun yung 5.
for me, I make use of my personal... We were able to analyze the scene. We check for 5S, we check for SENBIC. Now, the person is lying down on the floor. Right? Para lang hindi siya masaktan kasi mag-explain ako while we're doing the primary survey. So in the primary survey, what you normally do, you check for consciousness and breathing.
Asan pala yung sir?
So, we'll be tackling primary survey in a more thorough lesson for CPR, guys. But for now, I'm just going to give you an idea. You check for breathing and consciousness. If the person is conscious, you just communicate with him, introduce yourself, ask for consent. If not, and you see people and they agreed for you to say, to touch the victim, you assess your distance, you maintain at least 1 meter. Okay? Sir, bakit po hindi tayo pwede lumapit ng ganito kaagad sa victim natin? Why are we not too close to the victim during our survey the scene scenario in our emergency action principle? Bakit po tayo hindi masyado lumapit? Can you please move to my back? Let's say, he's the rescuer. Right? He's the rescuer. What will happen, guys? And I'm a bystander, like the first 3 guys there. And he's sitting here. Here. And I'm the bystander. Uy, ano nangyari dyan? What could possibly happen? Are there people like that? May mga ganun po ba tao? Yes. Meron at meron po yan. Meron pa nga po na, hindi pa na, uy, ano nangyari dyan? Ano nangyari dyan? Diba, ganun yung ibang tao, guys. So what we do, to be sure, is to keep a safe distance from the victim. Okay, you keep a safe distance from the victim. Then you, let's say, Miss Pangilinan, do you agree to help me to help him? When she agreed, what you do, you kneel down, okay? Then we move to the victim. If the victim is in a supine position, this is what we call a supine position. We have 3 different positions. We have the supine, we have the lateral recumbent position.
Wait lang,
Remember?
sir. Wait lang. Wait.
We have the supine position. We have the lateral recumbent position
Recumbent.
or side-lying position. We have the lateral recumbent position or the side-lying position. So guys, are you still listening?
Yes, sir.
Okay? So, side-lying position. And the last position will be the
Blank.
prone position or the planking position. Okay? Prone position or planking position. Let's say the person is normally some victims that you will see that are lying on the ground and are conscious will be in a lateral recumbent position. Is proceed to a lateral recumbent position. What's the practicality of this position, guys? Bakit po nakaganyan position ng isang biktima normally? And the victim is in a tuck position. At nakaganito po yan normally.
Masakit.
Kasi nakakaramdam sila ng sakit. Di ba pag natatay kayo, ay, natatay na ako. Parang sabi niya kayo, guys, my stomach. Di ba kaya po tayo gumaganon? Di ba guys, once you're not feeling well, you sometimes tuck your position. That's why commonly, if a victim has experienced extreme pain, the victim will be in a lateral recumbent position. Now, sir, if you see the victim in that position, again, ask for consciousness, check the victim is responsive, try to check for respiration, of course. If the victim is not breathing, or let's say not breathing, you have to proceed to primary survey, check for consciousness, airway, breathing, and circulation. Okay? Normally, if it's a mass casualty scenario, guys, what we normally do, if it's not breathing, you just reposition the head. Okay? Sir, and then you move to the next victim. Okay guys? Kasi in a mass casualty scenario, you're just tilting the head. How do we do that? Let me just show you. Let's move to a supine position. You just tilt the head. Okay? Because there's a possibility that the trachea, the airflow, is being blocked. That's why you just move the head, then you move to the next victim. Ganun po ang strategy natin sa mass casualty. For sa individual, yun po, you check for consciousness, airway, you check them out, normally open them out, check for obstruction, then you listen, and you feel, and then you look at the chest. If there's an air up and down of the chest, that means the probability of the victim only is being unconscious. Okay? So if the victim is in a lateral recumbent position, first things first, guys, that you have to do is normally perform the secondary survey. Okay? If you know that the victim is still alive, breathing, and technically you are not that sure of all of the injuries, first way to analyze if the victim is in danger would be for you to identify the cause of the victim's the victim being here and lying on the floor. Okay? So what we normally do, if we have a victim like this and is in a position like this, what we want to do is move the body as one unit. Okay? Before moving the victim, because we want to put the victim in a lying in a supine position, what we do, we try to move the body as one unit. Ideally, if there are bystanders, you ask for assistance. Worst case scenario, there's no bystander. Okay? What you need to do is to make sure that you move the body as one unit. How do we do that? When you say move the body as one unit, you do not move it this way. Okay? Naiiwan yung ulo. Okay? Why? We want to move the body in a manner that you are supporting the neck and you're moving the body as one unit. Nakuha po ba? Why? Because we are looking for the possibility of a suspicion of spinal injury. Okay. Yun yung isa sa pinaka-rule natin, guys, ha? Pagka magbubuhat po tayo, we always treat the victim with a suspicion of spinal injury. Because the main idea here is for you to prevent additional injury. Nangyari po yung kay Halina Perez. According to our trainer, he said na buhay pa si Halina Perez, pero namatay siya because of spinal injury na may naputol po veins doon sa kanyang neck area. Okay? So that's one of the things that we are trying to prevent. So in this position, guys, what you normally do, you support the head, okay, you position the body, okay, you support the neck on the hollow area, then you slowly move the body while supporting the straighten you up siya. You straighten up the pero guys, ang
Ito kasi gumagalaw, mentor.
hindi ka po dito kami
Tay ka na.
ang idea, nakaganyan siya, di ba guys? Just
Kunyari, wala kang
analyze,
pakiramdam.
meron ba siyang mga injuries? Kung wala naman, you can move the body of the victim while supporting the neck, then slowly supporting the back of the victim and lying him on the ground. Nakuha po ba? You're moving the body as one unit by supporting the neck. Right, go back there. So, that will be one scenario. If, for example, the victim is in a side-lying position or in a lateral recumbent position. Now, the victim is in a supine position. Okay? Let's say he's in a supine position. And we are trying to identify if we can move him with or without a spinal or a spine board. Meaning, if it's a situation that the victim has a spinal injury, ang iniiwasan po natin, guys, listen, would be galawin yung biktima nang hindi natin ina-assess yung spinal. Kasi ibang ginagawa, buhat lang eh. Hawak sa kamay. Ang ginagawa po, buhat lang, di ba? Ganun lang. Parang baboy, ginagawang baboy. Pero again, if you're a trained personnel, what you normally do, you try to remember your training. So, in this scenario, we are looking for the 6 signs of a spinal injury. We can perform the DCAP, PT, and S. This is our secondary survey, guys. Primary, we have the survey the scene. Under an EAP. Okay? 1, 2, 3. Secondary survey na tayo. Survey the scene. Ito po yung ginawa natin na yan. Primary po yung CABC. Secondary, we have the DCABC. We are looking for deformity, contusion, abrasion, puncture wounds, burns, or bleeding. Burns or bleeding yan. We are looking for tenderness, lacerations,
Dami.
swelling. Okay. And we are checking for 6 signs of spinal injuries.
Pero walo yan.
Okay guys, before we move on to you carrying victims, magbubuhat po tayo mamaya. So, we are looking for those things. So, in this scenario, I have him lying on the floor, he's unconscious. Now what I want to check for is the 6 signs of spinal injuries. So first things first, you have to check for consciousness. We did that in the primary survey, right? Hey sir, are you okay? Hey sir, are you okay? Hey sir, are you okay? If it's a woman, hey ma'am, are you okay? Hey ma'am, are you okay? Okay? So, in this scenario, you have to identify if he's conscious or not conscious. And you try to do the DCABC, or you look for different injuries. Okay? First things first, you look at the head area. So, in assessing the head area, what we do, we look at the face of the victim, try to gently touch the upper part. We have the cranial cavity, we have the thoracic cavity, we have the abdominal cavity, we have the pelvic cavity. We have the upper extremities, we have the lower extremities. Okay? Upper extremities will contain the brain. The thoracic cavity normally has the heart, the lungs. The abdominal cavity has the stomach, the intestines. Pelvic cavity has the reproductive organs. Okay? So, in this scenario, you look for DCABC. Normally what we do, we don't do this. Okay? We don't do that. What we do, you check for DCABC, tenderness. When you say deformity, is this nose still in place or is it already here? Is this jaw still in place or is it already here? That's what we call deformity. When we say C, contusion, that can be caused by a blunt object or a hard hit on the head of the victim. That could have caused him to become mentally unstable. Okay? Mentally unstable kasi meron pala siyang bleeding inside of his head, brain. Abrasion would be gas, Tagalog. When you say puncture wounds, there's a foreign object that penetrated the skin. Okay, puncture wound po yun. May mga rules po tayo dyan, we will tackle that when we do have our bandaging lecture. But ang main rules of puncture wound, guys, ang bagay na pumasok, huwag huhugutin. Ang bagay na lumabas, huwag ibabalik. Okay? Kasi baka po mangyari, pumasok yan, hinugot mo. Okay? And this is what will happen. Blood will be coming out. That's why you do not pull out something that comes in, and you do not bring in what came out. Let's say, for example, his stomach is out, his intestines are out.
Sir, pwede balik yun.
Sabihin mo kay sayang, balik ko, balik ko. Ganun po ba? Hindi po ganun ang gagawin natin. You just stabilize and immobilize the victim. Go back to the basic objective. Prevent, prolong, alleviate the pain of the victim. Promote recovery. So, burns, bleeding. In bleeding, you apply direct pressure. That's the basic when it comes to first aid for bleeding. Burns, you just cover the wound against infection. Tenderness means you are checking for fractures. There might be fractures in the body of the victim. Maraming klase po ng fracture, tandaan po natin. Merong open and closed fractures. Merong tinatawag na straight fracture. Merong diagonal fracture. Merong crush fracture. Merong drive-through fracture. So you have to be familiarized with those types of fractures. So at least you will have an idea of what you need to do if there's such an incident. Okay? And laceration means wakwak in Tagalog. What does that mean? Let's say I punch that glass on the door, okay? And it will generate a jab cut. Meaning, malaki or wakwak yung laceration and incision. Ang lacerated wound po yan, normally, open wound dyan na jab. May mga lacerated wound po yan. Pero kung inside wound po yan, clean cut po siya. Anong difference ng dalawa po na yan? Lacerated wound, masagin ko to, maka-injured ang kamay ko, sigurado po yan, wakwak yung aking skin. Pero pag inside wound po yan, may blade ako, hiniwa ko yung sarili ko, malinis yung pagkakahiwa. Okay? So, you look for those and swelling. Pamamaga, in Tagalog. Okay? So, before you transfer the victim, normally guys, ito medyo natatagalan tayo. Listen. Kaya lang tayo natatagalan, why it's taking us too long is because I'm explaining. But in actual scenarios, it's a fast procedure.